Hello, my name is Shelley Williams. I'm a geriatrician as well as palliative care physician at University of Chicago Medicine. No specific disease process correlates with the two specialties more than the underlying disease of dementia. Dementia involves both functional as well as cognitive impairment that involves not just the individual affected by this disease, but anyone who loves them and is a part of their care team. We generally call these individuals caregivers. Because the journey of living with dementia impacts not just the individual, but everyone who's involved in their day-to-day care, it is a disease process that requires, if we would say in our journey, a GPS system. And a big part of that GPS system is education. It's really important to know what are the warning signs of dementia, which may include difficulty with making decisions, difficulty with deciding about the day-to-day care within your home and outside of your home. It may even impact the most innate of our processes, like our ability to eat and our ability to walk as we get more progressed with the illness. It's not only important to know those warning signs of disease, but it's also important to know what are the individual stages of dementia. Dementia usually progresses from a mild stage to a moderate stage to a more severe stage. And generally in those severe stages, those are usually the things that result in termination of life, death. Death can occur because of difficulty with swallowing. It can occur because of recurrent infections as a person becomes more bedbound and has more difficulty with their language skills and identifying what their needs are. A big part of that GPS system, we said, is that education, and the Alzheimer's Association is one of our premier agencies that we refer most caregivers and individuals living with dementia. In addition to that education component, it's also important to have resources and supports in place. And those resources and supports should be in the form of social, which includes family and friends. It should involve professionals, which might be agencies like the Department on Aging, which is a premier resource as far as getting information, or it may even involve spiritual, your local church, or prayer groups, which provide support. It's really important to realize this is a disease that can impact anyone. 5.8 million Americans live with dementia. And we said it involves the caregivers as well. So there's at least 18 million caregivers currently who are living with dementia. It's really important to sort of take the weight off of the shoulders of those caregivers, especially as the person with dementia has more and more difficulty with making decisions, and provide another GPS tool, which I consider our values. It's really important to give caregivers a template for how do you make care decisions based on values. And that template involves asking the caregiver, who is your loved one? What do they value most? And what makes life worth living for them? And really utilize the answer to those three questions to make any decisions in the care of someone you love who's impacted by dementia. So again, I'm going to recap. We said that we really and truly want a good GPS system. It involves education. The Alzheimer's Association is one of those premier resources. We also said we need support resources like the Department on Aging, and one of the premier resources here in the Chicagoland area and hopefully in the United States in the near future is Share Network, which has a resource book which you can utilize as well. Living with dementia is a journey, and during that journey, you really need your care partners. So please utilize many of these care partners. Thank you.